Normal day is to come in and check the voicemails and see if there were any happenings that had occurred over the night that need immediate attention versus, kind of how to plan the day based on some of the emails and the voicemails that we'll get. We'll do a lot of group here. At Keystone, we'll do interpersonal groups, which can have a topic. It always has the theme of how you're feeling, kind of the ability for the patients here at Keystone to do a gut check, if you will, of their feelings and how that's affecting maybe the choices they're making in the day or their mood. Basically, you're trying to coach them in a self-assessment. And then they'll offer each other feedback, which is another added benefit to getting some insight into how you're coming across, things like that. Yep. We'll also do a lot of individual sessions. One of the things that I'll do is a diagnostic summary or impression based on quite a few assessments that we have done at Keystone here. Some of those might include the Milan, Quick View, MAST and DAST. There's quite a few of them. There's a problem assessment. The Milan is gearing a lot of that stuff towards any mental health concerns. It can suggest looking at particular areas versus, it helps to eliminate some of the possibilities that could be presented with a mental health illness. And kind of helps steer you towards what's really going on with the client, along with, the other assessments that we'll do, whether they're interview style assessments or if they're, actually more formal assessments. One of the number one concerns, I guess, that's pertinent in that's fresh in my mind right now is because I'm helping somebody try to figure out what the next stage is after treatment. It's a short-term treatment, 30 to 45 days. We will have some clients stay up to 90 days. That's more rare, though, than it is common. And given the changes that have taken place within their own psyche, their own personal being, as well as maybe some of the changes that have taken place from the communities they come from, what's the next step? What's the next stage? And obviously we know that a person's substance abuse problem isn't going to be cured in 30 days, 45 days, or even up to 90 days, that it's a day-to-day process. And a lot of research is suggesting that as a CD counselor, as a chemical dependency counselor, we're advocating for up to 5 years of care, medical model styles, so that it steps down from the intensity levels as the patient begins to, exhibit more capabilities and more stable thinking and feeling, etc. So we also address mental health concerns, and that there's a number of mental health concerns. We are level 3.7 level of care at Keystone, so we do have access to nurses, we have access to psychiatry, we have access to medical doctors. So there is a psychopharmacology avenue that we can also refer our patient to the psychiatrist that may be having a concern that could be aided through psychopharmacology. And a lot of the patients may have some antisocial personality traits. And I guess in my own opinion, one of the things I think that can clear up pretty readily with some abstinence is that antisocial personality behavior, antisocial behavior that takes place with drinking and using chemicals. Essentially you have to lie, you have to steal, you have to hide, you have to be dishonest in order to maintain an addiction. So the number one building block within the program of recovery is to become honest with yourself and with other people. But sometimes it's a little more difficult to get to than others. Obviously the patients are very afraid to tell the truth. They believe the truth will, whether consciously or unconsciously, they believe the truth will interrupt their life. And an unknown interruption is more scary than continuing to use substances. Even if it is causing jail time, the loss of marriages, the loss of children, the many consequences that go along with substance use. Another mental health concern may be a bipolar 1 or a bipolar 2 disorder. May be predominantly the major depressive episodes. It may also be predominantly the manic episodes. And a lot of times with patients in that category of Access 1 and historically with the DSM-4 diagnostic would be aided in a psychopharmacological way, whether that be, and obviously the doctor would determine what medication seemed to work best. A lot of times our patients have had treatment for that before, and if we can kind of get some medical records to substantiate whether they're telling the truth or not, I think that can help the doctors quite well. The DSM-4 is one of the diagnostic criteria. We now have the DSM-5, which is beginning to come into effect here. I think in October, I believe it was into effect, and it's the criteria for mental health diagnoses. So as a mental health counselor, it's effective in being able to identify what criteria fits best for this particular clientele. And then it's also pretty effective when you're talking with the client about these diagnoses, if it seems to hit or miss with that client.
So could you walk me through a simple one?
So let's say their antisocial personality traits are going on. There's I think up to 12 criteria for the diagnosis of antisocial personality disorder or antisocial traits, and this would be in a client that's 18 years or older. One of those criteria might be that they had been in trouble with the law prior to the age of 15, that they often disregard the rights and feelings of others, for whatever reason. And obviously with substance abuse, certainly there's some disregard for the rights and feelings of others. Those would be 2 criteria, for example, and a number of other ones that would kind of fit as well, that are in, kind of black and white and concrete. I believe that it's 7 or 9 to actually fit the criteria of antisocial personality disorder, versus having 3 of those characteristics may represent just the traits, diagnoses. Sure, yeah, we all have something, yep, and certainly, disregarding the rights and feelings of others in one area, if it doesn't necessarily interrupt daily function, if it doesn't interrupt family living, job, the functions of a person's life, then it certainly probably wouldn't be considered to be a disorder, right. But it certainly would be a disorder if the inability to respect the rights and feelings of others is going on in every area of their life. They're lying to the boss, they're lying to their wife, they're lying to their parents, they're lying to everybody so that they can kind of hide particular behaviors or feelings towards others, and that it's continually causing problems. It's one of the more difficult areas to work with. They have a tendency to blame others before they'll be able to take that look at their own choices and behaviors. AA language is take care of your side of the street. And so sometimes that's one of the obstacles within the program of recovery is it's necessary to be able to do that, to take a self-inventory, to look at your side of the street and not necessarily get caught up in other people's behaviors, what other people have done, the times in life that we may have been a victim of something or other, and not necessarily using that as a continued reason to make the choices that are selfish or dishonest or harmful to you or your family. I particularly like when the light bulbs go off, that it's not necessarily connected to something I've said or done. Another thing that's real beneficial at Keystone is we really work on the therapeutic community. So it's not necessarily contingent or that the progress in the patient only hinges on their work with their primary counselor or one of the doctors, that there's a microcosm of what their recovery program could look like after they leave Keystone. So it's kind of nice when they'll come to you and they'll, you're talking about a particular problem area, and obviously we need our clients' permission to work on particular areas just for success reasons. If you're constantly trying to play tug of war, you're probably not going to get very far. So if they're along with, and they're directing their own treatment, it seems to be much more effective. I think a lot of research as of late has reflected that. And so, you may identify a particular problem area, and when they're working on some of their paperwork or assignments that are given, cognitive behavioral assignments that they're given, some of the light bulbs will go off, and they'll resonate something that they heard from a speaker that comes in for the 12-step meeting speakers, or they'll be able to recognize a misdeed, and even though that sometimes is associated with some grief and some pain and some discomfort, there's still I would say some relief, for lack of maybe a better way of calling that, but some relief that they're becoming more aware of self. And I find that extremely validating as a counselor. You know, one of the biblical philosophies I think that could be translated would be, you know, you give a man a fish, you feed him for a day. You teach a man a fish, you feed him for a lifetime. And so, yeah, I think that is probably one of my personal main goals, yeah. You have to be able to associate with your community as well. So there may be some understandings that they lack that they may need to have, whether, you know, they're returning to a Native American community where there may some of the cultural, there may be a cultural variance. They need to, you know, probably understand some of that too. So we may refer on some of the areas we may not necessarily be experts at to continue to help that facilitate that growth. For the inpatient level of care, what we'll do is we'll refer them, usually at the minimum, an aftercare program, and that depends basically on their level of function. So, you know, somebody who's functioning fairly well, they've maintained a job, they maintained their marriage, things continue to look good, maybe they agreed to go to marriage counseling or couples counseling on their own with their wife as well, or family counseling with their kids involved as well. We may take a look at an outpatient setting for them, at whether that be an intensive outpatient, which would oftentimes be 2 to 3 days a week with the counselor. But it also may just be aftercare, which is an hour a week. We're more inclined to try to help them to accept as much as they possibly can for aftercare services. Research is pretty clear that the more you accept for help, the better they have a tendency to do for a longer period of time. And it seems to be that 5-year mark is kind of the magic number. Once a person, you know, and I'm quoting one of the doctors here, Dr. Ron Perkinson, once a person reaches that 5th year of recovery, their chances of going back to drinking and using drops quite significantly, I think between 3 and 5%. So that seems to be our magic number. And, you know, I like the opportunity to be able to advocate for longer extended periods of care too on this, as this is an opportunity. The aftercare program may last 6 months, it may last a year. It really depends on that next level of care and how that's going with those folks and those people working with that client. What we'd like to suggest is that they come back to some of the gatherings we'll have that honor the alumni. Once or twice a year we honor the alumni. The big famous one for Keystone is in August, usually in the summertime. So we'll have them come back as long as they've been sober for a certain length of time. I think it's usually about 6 months. There may be some special instances too if we know they're working a good program and things are going well. And then there's a winter conference that we'll also have coming up here in February that does kind of speak to that as well. So we want to continue to be here, but they also, again, need to be able to kind of fish on their own. But checking in with us is certainly one of the benefits. You know, we don't always get a chance to see some of the growth that takes place after we leave, and so if we get a chance to see them at some of these gatherings, that can be pretty beneficial for us as well. Within the aftercare, we also strongly encourage 12-step recovery meetings, AA meetings or NA meetings based on their substance of choice. In larger communities, there may be even some more subgroups that would be related more towards the NA meetings, the Narcotics Anonymous meetings, such as Crystal Meth Anonymous. I think some places in California oftentimes have even some of those smaller subgroups noted for that particular substance. And within the 12-step recovery, there is already a foundation of recovery principles. There's guidelines, and one of the major pieces of that is working with a sponsor. General rules such as guys stick with guys and women stick with women is obviously necessary for continuing to growth and not getting necessarily distracted for obvious reasons, and working with others, paying back. You know, one of the things that we teach oftentimes at Keystone comes directly from AA, which probably directly comes from biblical teachings as well, is when nobody else would listen. You know, the alcoholic is significant, you know, has experienced particular life occurrences that make him uniquely capable of hearing when other people are tired of listening. That one addict helping another is without parallel. This is a direct quote from the Alcoholics Anonymous book. So that is we always talk about that, and it's almost secondhand, I forget to mention. So that's, obviously we can't keep people clean and sober after 1 hour a week. It's certainly going to have to be more substantial than that. Absolutely, people, places, and things. The adage within the AA program is if you keep going to the barber, you're eventually going to get a haircut. And so obviously, showing up at the bar after treatment for 30 days, 45 days, to see old friends is like sticking your foot in a trap, knowing you're doing it. And so that is a big piece. In changing the people you're hanging out with, maybe they're directly connected to the 12-step program, maybe that's in a spiritual or cultural healthy aspect of your community. We work with a lot of Native Americans, and maybe that involves going to the tribal centers or the IHS facilities that facilitate some of those extra works, and that they'll also encourage continuing that work with others. It's a big piece. We try to instill that they're still important. Their importance never really faded. They took themselves out of the game through their substance use, but they're absolutely welcome to come back in and rejoin life. Relapse is a reality in substance abuse treatment, and we would first, depending on the length of time that they had in recovery or the length of time that they had sober, that would depend on the next level of care that they may meet.